Now, what we're going to do in talking about these infections is we typically start from the outside in, and then we finish it up by talking about the opportunistic fungal infections. So the first fungal agent I'm going to talk about is a superficial fungal infection. And by superficial, we mean we are infecting the most superficial layers of the skin. In fact, not really even living tissue. So there's not really a major health issue associated with the superficial infections. It's mostly a cosmetic problem. Now, the disease that we're referring to is Tinea versicolor, also sometimes called pityriasis, and the causative agent is called Malassezia furfur. So in this case, you definitely have to know the organism, and you want to know what the name of the disease is. So you have Tinea versicolor. The reason it was given that name, versicolor, is because you can have hypo or hyperpigmented spots on the skin. So again, it's a superficial infection, hypo or hyperpigmented spots, and more commonly you're going to see, as is shown in the images here, hypopigmentation. Now, where this is very, very common are in individuals who work outside in warm climates. So they're outside doing roofing or construction work, and they're constantly wet, moist from sweat. That creates a really good environment for Malassezia to grow. And so even once you treat an infection with Malassezia, they typically will get it recurrently because they're always kind of in that environment. So more than likely, if you get a question on Tinea versicolor, it's going to have to do with the cutaneous or superficial infection. Although, just to make a note, you can actually get fungemia in infants from Malassezia. And that is due to the fact that they're usually on IV lipid supplements. Okay, so you can get a very serious infection in preemies, but the most common thing they're going to talk to you about is the superficial infection. Now, diagnosis for Malassezia is a KOH mount, and what happens is you're going to see two things in that mount. You're going to see short, round yeasts and little kind of curved hyphae. And the buzzword for that is spaghetti and meatballs. So you have a spaghetti and meatball stain. Sometimes I've seen it referred to as bacon and eggs, but that's kind of the buzzword for that particular type of stain. Very, very diagnostic for Malassezia. You can also use fluorescence under UV light because you get kind of a coppery orange colored fluorescence if you put a UV light on the lesions. Now, the treatment's really pretty simple for Malassezia. You tell your patients to go home, get some Head and Shoulders, some dandruff shampoo that contains selenium sulfide. And you apply that to the lesions probably every day for about a week in the shower, as long as you can stand it. Sometimes it'll start to burn. Then you wash it off, and it should clear the infection. But again, a lot of people that get pityriasis or Tinea versicolor tend to get these types of infections over and over again. Okay, we're going to move in to one layer and look at the cutaneous fungal infections. Now, this is in living tissue, so you can get an inflammatory response as opposed to the superficial fungal infections where there really is no inflammation associated with them. So the organisms we're going to talk about are the dermatophytes, and you've all probably seen commercials dealing with the dermatophytes, and I'll talk about those in a little bit. These are all monomorphic fungal infections, so they're not able to convert to a yeast form. They're always in the mold form. And the dermatophytes infect the skin, the hair, and the nails. All right? Now, this is one time where we're not going to focus on species. We're going to focus on the genus. So the three genera that are really important cutaneous infections are number one, Trichophyton. And how you're going to remember what it infects is by the name, tri, meaning 3. So we infect the skin, the hair, and the nails. Okay? Now, the other 2 genera that are commonly associated with cutaneous fungal infections are Microsporum and Epidermidophyton. Clearly, we're talking about cutaneous infections, so you know they both infect the skin. Then you just have to remember one additional fact about each one of those, and that is that Microsporum infects the skin and the hair, and Epidermidophyton infects the skin and the nails. All right? So, what is characteristic about these infections? Number 1, itching. Very, very common. So there is pruritus associated with a lot of the dermatophyte infections. Now, these are commonly called taenias or ringworms because initially when you saw these in the skin, it looked like there was a little cutaneous or subcutaneous worm embedded in the skin. That was just a misnomer because clearly they're not actually worms, but that nomenclature kind of stuck. Now, one of the things I also want to point out, again, because we're in living tissue, sometimes you can get a very pronounced inflammatory response. And if you do, you have probably acquired that dermatophyte from a domestic animal, a dog or a cat, when you have a lot of inflammation. If there is really little inflammation, you have probably acquired that person to person. Now, the diseases, again, all go by the taenias. Taenia, again, meaning worm-like, but keep in mind these are not worms. Ringworm of the scalp is called Taenia capitis. And the most serious, where you have a lot of inflammation and permanent hair loss, is Favis, which is from a domestic animal. So that's one where you've gotten it from contact with a domestic animal. Some of the other taenias, we have Taenia barbae, which is ringworm of the beard, Corporus, which is ringworm of the skin. You have Taenia cruris, and the common term for that is jock itch, and Taenia pedis, and the common term for that is athlete's foot. And I'm going to introduce one more for you here, which is Taenia unguinum, which is a cutaneous dermatophyte infection of the nails. Now, how are you going to diagnose these? Again, Microsporum actually fluoresces under Wood's lamp, whereas Trichophyton and Epidermidophyton do not fluoresce. You can also do KOH mounts and do the skin scrapings and look for the arthroconidia and hyphae, and that should be diagnostic. Now, the treatments for these, a lot of over-the-counter antifungals, topical imidazoles for the cutaneous infections. Now, the commercial that I was referring to was the one where they were talking about the nail infection, and they showed that little fungus popping up the toenail and jumping in and kind of partying there with the other fungi. And the reason I bring that up is because if you do have Taenia unguinum, which is an infection of the nail bed, actually topical treatments aren't going to work. That's when you have to go to something systemic, so an oral imidazole, for example. Okay, so we did superficial, cutaneous, and now we're going to talk subcutaneous mycoses. A couple of things I want to mention before we really get involved in this particular organism is, number one, this is clearly not the only subcutaneous fungal infection, but it's most testable for the USMLE. Most of the other ones are extremely rare in the US and just not very testable on the USMLE. This is also the first of our dimorphic fungi, okay? So, what I've done here is shown you 2 images. The first one is going to be the mold form, mold in the cold. So at room temperature, this is the mold form, and the yeast form is what I'm showing you at the bottom. And the description for the yeast form are cigar-shaped yeast, okay, cigar-shaped yeast. For the dimorphic fungi, what's most important for you is to know the yeast form, okay? Why is that? If you're trying to diagnose the patient, That's the form that you're going to have to identify, not the environmental form. All right, so the yeast form is most important. If you can grasp onto the environmental form, that's all the more better, but the yeast form is really the most important. The diseases caused by Sporothrix-Schenckii, there's really two different types of diseases. One is sporotrichosis, which is the subcutaneous form of Sporothrix-Schenckii. And you've all seen this in the board review books. This is actually called rose gardener's disease. And the vignette is somebody was out pruning their rose bushes. They got pricked in their skin maybe at some point by a thorn that introduces the organism into that cut. And you wind up with one of two presentations at that point. You wind up with either a fixed lesion, which I'm showing you at the top, or lymphocutaneous spread, which I'm showing you at the bottom, okay, where the initial lesion heals up and begins to spread, the organism spreads along the lymphatics. Now, by far, what's a little bit more fun is thinking about pulmonary Sporothrix-Schenckii, which is called the alcoholic rose gardener. I myself don't know too many alcoholic rose gardeners, but you might imagine somebody wants to throw back a few cocktails and go out and play in the rose bushes. In this case, though, you don't get the subcutaneous disease, you wind up with a pulmonary infection. Now, in the case of pulmonary sporotrichosis, let's say you get a good sample of the sputum. What are you going to find in the sputum? You're going to find cigar-shaped yeast. Let's say you look in those lesions from sporotrichosis, subcutaneous. What are you going to find? You're going to find cigar-shaped yeast. All right, so that's going to be important. Now, the treatment for the subcutaneous fungal infection is itraconazole or amphotericin B. And you're all aware that amphotericin B is really extremely toxic. It's what makes fungal infections very difficult to treat.